Hello, my name is Martin Lipscomb, and in this nursing conversation, I'm joined by Mark Risjord. Mark is a professor in the Department of Philosophy at Emory University College of Arts and Sciences, Atlanta, USA. His books include Philosophy of Social Science, also Nursing Knowledge, Science, Practice and Philosophy, and Woodcutters and Witchcraft, Rationality and Interpretive Change in the Social Sciences. Mark contributes to journals such as American Philosophical Quarterly, the Journal of Medicine and Philosophy, the Canadian Journal of Philosophy, Studies in History and Philosophy of Science, and Nursing Philosophy. I could go on. Currently, Mark's interest is focused on questions of how scientific models can be the basis for predictions and other inferences. However, today, Mark, I'm going to take you back in time to 2016 and a chapter that you wrote for an edited book I put together titled Exploring Evidence-Based Practice, Debates and Challenges in Nursing. Now, your contribution to this work is one I've been asked about on several occasions, primarily, I think, because in a book about evidence-based practice, you argue that EBP contains or is built on an important contradiction. Let me quote what you wrote at the start of your chapter, a chapter titled Evidence and Practical Knowledge. The phrase evidence-based practice is something of an oxymoron. Evidence provides justification, yet practical activity is not the sort of thing that calls for justification. Clinical practice requires a suite of abilities, instruments, tools, and materials, not to mention patients. People, objects, and activities are simply not the sort of thing that can be justified by evidence. Justification is appropriate for propositional knowledge or knowledge that. In these cases, knowledge can be expressed in a sentence, and something is evidence only insofar as it gives us confidence that a proposition is true. To have practical knowledge, by contrast, is to have knowledge how. It is the ability to do something. Questions of justification cannot arise for know-how. Strictly speaking, then, evidence-based practice is a logical impossibility. End of quote. Now, Mark, first, it's great to speak with you. Thank you for your time. Now, many people might consider the comments I've just read out to be inflammatory. You appear to propose here that, by definition, evidence-based practice, at least as commonly understood, is grounded on a logical error. Please, could you expand upon the quotation I've just introduced? Could you explain your argument to us?
Thank you, Martin. It's a pleasure to be asked that question. I think this is a really important point that hasn't gotten enough discussion in the large literature on evidence-based practice in nursing. The fundamental distinction in that paragraph is one that's a commonplace in philosophy, and that is that there's two kinds of knowledge. So the philosopher's terms for this are propositional and practical. We mark this in English and many other languages with syntactic differences. So in English, I say something like, I know that the COVID-19 infection rate in New York is going down. I know that. But I know how to make an omelet. I know how to tie my shoes. I know how to ride a bicycle. So it's that how difference in our language. And this marks a very important difference in the knowledge that's involved. So if I say I know the infection rate in New York is going down, it's entirely fair for you to ask, what's your evidence for that? How do you know it? What sorts of data do you have? Where did you read it? A question like that is completely appropriate. If I say I know how to bake bread, asking what my evidence for that is odd. It's, I'm not sure what you're asking for. I can tell you that my mother taught me how. I can display my knowledge to you by baking some bread for you, but evidence is just out of place there. It's like asking for the flavor of the sun or the color of a number. These two things, evidence and practical knowledge, are just in different categories. So that's the sort of fundamental logical mistake. Now, there's a straightforward answer to this question, which I think is in part correct, and that is, well, evidence-based practice is just a way of saying that what we're doing is we're getting evidence for rules and procedures. So what we want to do is make sure that the procedures that we're teaching nurses or setting up procedures in a hospital kind of setting, we want to make sure that those are based on sound research.
Yeah.
And then we take those rules and procedures and they get translated into practice. The problem here is that it's well known to anyone who's read Patricia Benner's Novice to Expert is that following rules is novice behavior. Experts do something that's importantly different than follow the rules. They respond to all kinds of contingencies, which means they have to do things that aren't mandated by the rules. And there's some one of the things I approached in the essay is there's some bad ideas out there about how rules gets translated into expert performances. Right, so you might think, well, the rules are just kind of internalized, so I'm like quietly following the rules, not consciously following the rules. But the thing is that experts importantly act in ways that don't follow the rules. It's not just a matter of the rules going quiet. The rules are somehow applied in ways that the rules couldn't say. And rules are not just habits. We want expert practice to be intelligent, not automatic. And a further problem is that the expert practice isn't always correct. So one of the studies I cite in the article is about tracheal suctioning. And it was an observational study where they observed nurses doing the procedure, and then they asked them questions about the rules and the procedures. And what they found is that expert nurses both knew the rules in some cases, but failed to follow them. And it wasn't like the conditions were special. They were just doing it wrong. They knew the rules, but they were doing it wrong. And in some cases, they reported the rules incorrectly, but they were doing it right. So there's this mismatch in expert behavior between the kind of explicit propositional knowledge that the nurses have and their ability to do. So while it's all well and good to think of evidence-based practice as a kind of shorthand for evidence-based policy, the fundamental problem here, the deep problem in this area is how do you get policy or set of rules that might be justified, fine, to properly inform expert practice. That, I think, is the really deep issue when we think about expert practice.
That's really interesting, thank you. If you're correct and your argument is persuasive, what implications or inferences might we draw for the way evidence-based practice is introduced to or taught to nursing students, as well as practice by nurses?
Yeah, I think this is the important the upshot here, and I think there's two ways to get research-based knowledge into expert practice, and one is, of course, evidence-based policy and procedure and rules. And so I'm not arguing that our rules somehow shouldn't be based on evidence. Yes, of course, we should have policies and procedures that are based on the best research. And of course, nurses in nursing school should be learning those and mastering them in an intellectual way. But the important upshot here is that shouldn't be the only path from research knowledge to nursing practice. And what I want to advise is that we think ecologically. Knowledge how is embodied. That is, it's an ability to do something like bake bread or tie your shoes. It's not just an intellectual thing you can learn and master. Practical embodied knowledge is always in an environment. So we're always responding to our environment in some way. So where we might think about rules and procedures as somehow in your head, practical knowledge is in you and your environment. And so what experts are doing is they're responding fluidly to the contingencies of their environment. What that means is that by changing the environment, we can change the practice. Not a matter of just changing the rules, it's a matter of actually changing the environment. So we need to first study how the environment can make things better and worse. And this is something we don't do enough of. So as far as a change in research here, I think we need to look more at how differences in the nursing environment can make a difference in outcomes and patient experience and all the rest. Again, in that tracheal suctioning study, one of the things they found is that at the time, the procedures required nurses to calculate the size of the catheter. So you had to know the size of the tube you're suctioning, and you had to then calculate, using a little mathematical formula, the appropriate catheter to use. This puts an enormous cognitive load on the nurse, right? There's something else you have to do. It makes it very difficult. One of the things that happened in response to this kind of knowledge is that some companies started color coding the catheters. So all you have to do is look at what look at your environment and you can see immediately that it's the right size, right? So there's a change in the environment that makes an immediate change in practice. So it's looking for those kinds of things. Now, then that means we also, as practitioners and as students who are moving from the novice to the expert, is one needs to be reflective not just about the rules, but how the environment is nudging you one way or another. Is there something in my environment here that's I'm responding to? Can I reflect on that and get better at responding to that? And when we think about being a nurse manager or someone with a bit more control over the environment, can we change the environment in ways that nudges the nurses better? I think in nursing education, it also just comes back to a point that's very familiar to all of us. This isn't novel at all, but it means more coaching and less distance. You know, learning the rules, the procedures, the background knowledge, the theories. This is all essential. But at the end of the day, that relationship to your actual practice is very much like the relationship between a coach and a sport performer, right? You're the performer. You're going to do this. You need somebody who's watching your performance and looking at how you're relating to the environment and saying, okay, do it a little better. This, after all, is exactly how we've learned to tie our shoes, ride bicycles, drive a car, bake bread, is because someone said, there's too much water in that dough. It's not going to come out right. And that's something you learn to recognize. So that aspect of nursing education is absolutely essential. It's something we have to pay attention to as a kind of evidence-based practice. Right?
Okay. From rereading your chapter, the things which I took away from it were the importance of, and you've mentioned it just now, ecological or embodied action, and the context, as you were just saying, in which people work, which would push us to perhaps look more at social and behavioural sciences, the new psychology, and you mentioned nudge again, so we're thinking of those
Yes.
people. The other thing which I took out from your chapter was an emphasis on a response to problems not being just more education, that we just need to tell people what to do as if that magically solved the problems, which I think, again, has come out in what you've said. But the other thing which I thought was really interesting was your focus on agency and action. Would you just say something a little more about those two things? Because that was quite an important part, I think, of your argument.
Yeah, and this is where this is the philosophical depth of this, and it's interesting how these questions that seem like they're more policy and based and organizational perhaps really get us to some very fundamental things about what it means to be human and how should we think about ourselves. And there's a traditional way of thinking about what it means to be a person, to be an agent, to be someone who acts in the world in a way different from a mechanical object. And that's a way that emphasizes the cerebral parts. And so you think of action as primarily deliberate action. So it's a case where I've decided to do something. So I'm thinking, well, how do I spend my afternoon? It's a pretty nice day out there, so I'm going to go for a walk. And so I put my shoes on and I take a walk. That's a deliberate action. It's true that we do a lot of this. That gives you an idea of action being all the crucial stuff is happening in my head first, and then it's just a matter of me doing, right? The thing is that so much of our action is actually not like that. So when you got up this morning and made yourself some breakfast and got ready to go about your day, you did an enormous number of things. You heated the kettle, you made tea or coffee, you made your oatmeal, a whole bunch of things that you did. You spent how much other time it takes you, half an hour doing things. And I'll bet you weren't thinking about any of those things at the time. You were thinking about other stuff, right? What's happening in the world, what your day is going to be like, these sorts of things. That's a whole lot of action that's not deliberate in the sense of making a decision and then doing. You didn't say to yourself, I want some tea, so I better turn the kettle on first. Okay, first we turn on the kettle. Then I need to find the tea, right? If you did all that, you'd never get off the ground, right? So another way of thinking about our lives is to emphasize that practical engagement part. And this is the ecological thinking about agents. So we don't think about agents as sort of living in their heads and then only accidentally or as a, just be contingently moving about in the world. Rather, we think about agents as engage with the world in the first instance, right? That's what we're really doing all the time. And then sometimes we are able to, we have time, we take a breath, and we can reflect on what's just happened, what I'm doing. So it's that moment when you realize that you're making tea, but you just put a spoonful of flour in because you weren't really paying attention to what you're doing, right? It's like, oh, wait a minute, maybe, and now here's a moment for ecological thinking. How did I get flour into my tea? Well, I've got the sugar and the flour in the same kind of container. So my environment is inviting a certain sort of mistake. If one was blue and one was red, or one said flour, then my environment would be giving me a nudge. That is, it would be shaping my behavior in a certain sort of way. And I can do that deliberately. I can set up my environment to shape my behavior. But that really requires us to think about ourselves in a different sort of way in which we're practically engaged with.
Mark, that was really interesting. There's clearly a lot more that can be said here. However, thank you. Let's wrap it up there. Thank you once again for your time today.
Most welcome. It was a real pleasure. Thank you.